Hello, and welcome to our live stream on school safety. We are so glad you could join us. It's back to school time for communities across the country, and whether your school started weeks ago or are just getting ready to, we hope to provide some insight into what school safety means, how to think about school safety planning, and what the research shows about implementing school safety strategies effectively. We timed this event for back to school time, but we hope that what our experts will offer today will help year round. I'm Kara Gavin with the Michigan Medicine Department of Communication, and I'll be your moderator for this event. I'm very fortunate to be joined by three University of Michigan experts who can help us understand the complexities of school safety in a comprehensive way and choose the best strategies for your community's needs. All three of them are also parents of students from elementary school to college. Each panelist is a member of the U of M Institute for Firearm Injury Prevention, which houses the National Center for School Safety and the Michigan School Safety Initiative. Dr. Cynthia Ewell Foster is a clinical child psychologist by training and a clinical associate professor in the Department of Psychiatry at Michigan Medicine. Her research focuses on youth suicide prevention with particular interests in family, community, and systems-based interventions. And she's also director of the Community Engagement Corps at the Institute for Firearm Injury Prevention. Dr. Justin Heinze is an associate professor in the School of Public Health in the Department of Health Behavior and Health Equity. He's also the director of the Institute's School Safety Section and co-director of its Research and Scholarship Corps, and he's the co-director of the National Center for School Safety. His research focuses on how schools influence disparities in violence and other risk outcomes from an ecological perspective that includes individual, interpersonal, and contextual influences on development. And Dr. Xingfang Shi is a research associate professor and co-director of the Training and Education Corps at the Firearm Institute and the evaluation director of the National Center for School Safety. Her research interests include health disparities in firearm injury outcomes and the effectiveness of community-based violence interventions. Sorry about mispronouncing your name at first, Dr. Xie. Thanks all for joining this important discussion. And before we begin, just a couple of housekeeping items. If you're watching this live, please feel free to submit questions at any time, and we'll select some of them during today's chat to discuss. Simply comment on this video on whatever platform you're using, but do be aware that your name or your profile name will be visible to others who are participating. If you prefer a more anonymous option, you can send a private message to us via Facebook direct message on facebook.com/Michigan Medicine. We know that there may be many questions, so we'll likely combine some of them that are on the same topic. So know that your experts also can't give specific advice for an individual situation that you might be facing, but we can comment more generally. We're going to be talking about some sensitive topics today, including interpersonal violence and self-harm or suicide. So just to note that if someone you know or yourself is experiencing a mental health crisis of any kind, this is an important number to know, 988. You can call it or text it and reach the National Suicide and Crisis Lifeline, 988. If you can't stay for the whole chat or you want to share the recording with a friend, you'll be able to watch after the live stream ends through the Michigan Medicine YouTube channel. And the link will also be posted on other channels for ease of access sharing. So I'm going to start with you, Justin, Dr. Heinze, and help us understand what school safety means from your research focused perspective and how to think about school safety when thinking about strategies and plans for a community, and think about, talk to us about what communities should consider when they think about school safety. You know, there seem to be a lot of misconceptions about the best way to improve the environment at school for students. So maybe some context on that as well. Thanks.
Sure, and thank you so much for having me. I'll start with just a comment and a thought about how we're even framing this conversation. I love that we're talking about school safety. We're not talking about violence prevention. We are thinking a little bit more holistically about the promotive aspects of school. Because I'm a parent as Kara mentioned, others are parents too. I'm excited that my kids are going to school this fall, and I think their parents around the country are too. And it's dangerous, I think, to frame schools as these very violent places that are where students are getting hurt, when in many cases, schools can be among the safest places for our youth to be. And yes, we are always working to make schools to be the safest learning environments as possible. But using some of that positive language, I think, can help us, change the tenor in the way that we're approaching these conversations, not just with schools, but with parents and other stakeholders and investment parties. This idea around comprehensive thinking, we feel, is incredibly important to the way that we're approaching this big question of how do we make schools safer. So it's not just, the time an incident happens, when there might be violence or when there might be concerns around students, but it's also thinking upstream and more of that prevention lens. And what are some of the things that we're trying to do in preparation or to try to deter violence that might be happening? But then also, and I think others will speak to this more later on, the recovery side of things. In the event that violence has happened, or in the event that there might be concerns even in the broader community that students are exposed to, how are we making sure that they're getting the support systems that they need? And we have developed at the National Center for School Safety a conceptual model. This is how important we think this comprehensive piece is, to think about this more global aspect of safety. And it's not just physical injury. And I can't stress that enough. We also think about the psychological impact that different forms of safety and violence exposure can have on our students that might be disruptive to their learning. And ultimately, at the end of the day, we all want to see our youth grow. We all want to see that sort of positive youth development. And so we're thinking very broadly around the physical environment, the social environment, the way that we're interacting with each other, as well as the attentive environment, thinking about if you see something, say something, because there are, even though it's very difficult to predict when violence might happen, there are often correlates that we can at least consider and also address through our intervention programming that we think are going to make these incidents less likely. So I think for that piece, just that perspective can help us then think more broadly and again, more holistically about what schools can be doing. And in many cases, it's trying to inform thinking, and you mentioned from the research side of things, inform thinking around what really are schools facing, what are some of those challenges. And I think there are a couple of myths that do circulate, Carrie, you had mentioned it. One of the biggest ones being that these school shootings, they're so salient, and everybody can name some of these schools off at the top of their heads, that they're happening all the time. When that's just, in fact, not the case. It's actually a very, very small percentage of firearm-related violence is happening within schools, and an even smaller percentage are these major mass shooting events that happen within schools as well. And so the only risk there, I think we are preparing for firearm violence that might be happening in schools, but we have to think about all the other forms of safety concerns that might be facing students as we're considering, again, this more comprehensive approach to school safety. So what are we doing to prevent firearm injury? Absolutely. But how are we promoting student mental health? How are we fostering relationships with students and teachers? How are we considering behavioral management if there are concerns? How are we integrating community perspectives and opportunities for schools to draw from the resources in a community as we're thinking through what are the specific challenges that schools might be facing, and how can we tailor the suite of activities that we want to use in a given school? Because there's not a panacea. If there was one program, one thing that I could say every school should be doing, I tell you right now, we could call it a day. It doesn't exist, unfortunately. And so part of what we're doing at the Institute, as well as the University of Michigan, is helping schools make some of those decisions, drawing from the evidence base about what we know around school safety related programming.
That's great. And actually, could you talk briefly about how a school community could access that service?
Well, if you would love to work with us, we'd love to work with you. We are home to two training and technical assistance efforts at the University of Michigan. One is the National Center for School Safety you alluded to. We're a federally funded training technical assistance center that works with schools around the country. And the whole purpose of our center is to work with schools to identify programs that are going to be fit for their needs. Ideally, we are working with them to select evidence-based programs, but what we have found is that sometimes the selection piece, we want to do this, this, and this, is the easy part. It's the implementation and the sustaining of those efforts that can be really challenging, because schools have so much on their plates. There are so many things that need to happen. And so to have that support can be helpful. We have trainings that are freely available to anybody who might want to use them. We have technical assistance experts who have previous experience in education that are able to come out to your school to work with you. And we're really excited over the past year to launch an initiative that's specific to the state of Michigan, the Michigan School Safety Initiative. Any school in the state of Michigan can reach out to us for services as well. We'll work with you to, again, identify the programs and strategies that make the most sense for you, can send folks out there. We're trying to draw data from these schools so that it's not just us saying this is what we think schools need, but we ask schools every year, what are some of the things that you're facing in the field? What are you seeing? And then we're trying to develop resources that can help schools address those concerns as they arise. So to be responsive rather than prescriptive.
That's great. I imagine you hear from schools things about metal detectors or clear backpacks, things like that, and leaping to those kinds of very specific tactics. Can you talk maybe about some of the myths that have evolved around those kinds of things?
Sure, and I think that sort of draws from that first one that I mentioned, that we're oftentimes thinking about those major mass shooting events when we think about metal detectors, cameras, armed personnel. And again, the thinking around sort of what we call school hardening is we're trying to make these buildings physically secure. And that overlooks, again, I think many of the challenges that our students are facing. When we've talked to students schools in the state of Michigan, as well as across the country, the number one concern that we hear from schools is around student mental health and around social emotional development and around bullying prevention. And that's not what some of these hardening measures are designed to prevent. And so, yes, we can talk to schools about how to implement those strategies, but then also what are you going to pair with those strategies? What are some of the social emotional development, the mentorship programming, the behavioral threat assessment, if that's what's of interest, that we can pair with some of those strategies to, again, be thinking around multiple issues. The other thing that we really need to consider and that we do see in the data is the disproportionate burden that some of these hardening strategies manifest. And that's often in schools with minority populations, often with schools that have fewer resources. And so you're trying to make decisions around what can we be doing. Cameras are expensive, personnel is expensive, but then also if there's a history of interaction with police or law enforcement within your student population, what does it mean to have a police officer in full uniform at the door versus an SRO, a school resource officer that might be in plain clothes that has a very different role or perspective than your typical law enforcement officer. So working with schools to make some of those decisions, how to navigate the conversations with your school board or with your local parent groups or community groups, so that, again, we're selecting those programs that make sense for schools.
Fantastic. I think this is a perfect segue into Cynthia Ewell Foster's work and what we wanted to have you talk about today, and this idea of connectedness, of mental health, and I think this idea of trusted messengers too. So I think Dr. Foster, Ewell Foster, please talk to us about that.
Yeah. Hi, everybody. Good afternoon. It's really a pleasure to be with you, and I really appreciate, this model that Justin has articulated. This comprehensive model about what it means for kids to feel safe at school and for schools to be a safe place. And I think this issue of how kids are feeling psychologically when they walk into their school buildings is so important to consider. And this idea that promoting healthy kids is a really core part of school safety. And I think it's difficult to have a safe environment when you're not also attending to that piece. So I really appreciate the opportunity to talk about connectedness. It's a construct that's very near and dear to my heart. And I think schools are such a key part of creating healthy youth, right? Our kids are spending 30 to 40 hours a week in their school buildings. Their teachers, the mentoring relationships they're developing in schools are such a core part of the way kids develop over the course of their life. So what do I mean by connectedness? I want to start and piggyback on something that Justin said earlier, which is this idea that schools are part of an ecosystem in a community. And I think it's really important to remember that those of you who are working in schools are not alone in this work. And in every community, we have a host of folks who care deeply about kids. And I don't want our folks who are working in schools to feel like they're the only ones, fighting this battle for kids. And so remembering that there's a community of folks, our healthcare systems and our mental health providers, our law enforcement colleagues, our coaches, our faith communities, so many folks who care deeply about kids and really wanting to think about connectedness in the community so that schools don't feel siloed, and like they're in this alone. So that was one point I wanted to make. In terms of, individual connectedness, I want to talk about that, at the individual level, and particularly with respect to school. So when we talk about school connectedness, what that is kids feeling like when they walk into their school, that's a place where they belong. It's a place where somebody there cares about them as a whole person, right? They feel like they matter to their school community. And it's such an important construct. We found in our work, so I'm part of the Youth Depression and Suicide Prevention research team here at the University of Michigan. And we've been thinking about this construct of connectedness for a long time. Maybe 10 years ago, the Centers for Disease Control and Prevention actually labeled connectedness as a promising suicide prevention strategy. And I think it has such important implications for school safety as well. So in some of our work, we continue to add to decades of research that really talk about this idea that kids feeling connected to their schools, feeling like they matter there, is protective against a host of adverse outcomes for kids, a host of bad things happening. And I'm going to focus specifically on suicide prevention, but it's much broader. So I want to share, if I could, a couple of studies that come from our research here at the University of Michigan that I think are impactful. They certainly meant a lot to me. So the first is a project that we worked on, was funded by the CDC, actually looking at connectedness as a preventive strategy for kids. And we were working in a very low income, under-resourced community here in Michigan, where the kids who were walking into school every day had a lot of challenges in their lives, a lot of exposure to violence, poverty, unemployment in the community, just a lot of concerns. And nevertheless, a big chunk of the kids in our sample indicated that they felt connected in their schools. So that was amazing. And kids who did report feeling more connected at school reported lower levels of depression, lower levels of suicidal thinking, less social anxiety. They were having less sex. And they also reported that they had higher self-esteem and they were using their free time in sort of a healthier, more adaptive way. So just one of many studies that indicates how important this is in terms of kids' development. And I just want to emphasize one of the things that I thought was so heartening in this study was that, again, this was a really, really under-resourced school. These kids had a lot of challenges in their lives. And, it brought home for me the idea that connectedness isn't necessarily about resources. It's about how you as an adult make a kid feel when they walk into the building. And, we don't need necessarily money to do that. Certainly it helps. But, calling kids by name and, asking about their families and knowing what's going on in their lives, like that's something that we can all do, every day as kids walk into our buildings. So that was one study I wanted to share. The other was a study called ED Stars that my mentor Cheryl King led in concert with some other folks in the suicide prevention community. It was a 16-site academic medical center trial funded by NIMH. And the point of the study was to develop a screening algorithm to try to identify kids who were at risk for suicide coming into emergency rooms. So this was like a community sample of kids, right? They weren't coming into the emergency room necessarily because they were at risk for suicide. They could have been coming in with norovirus or a broken leg or, any of the things. But we were trying to understand what predicts, what can we figure out that predicts kids' risk for making a suicide attempt in the months after we have this, moment in time with them. And the only thing that predicted that had nothing to do with suicide was school connectedness. So I think it's just another example of how important this is for kids. The other things that predicted were things you would expect. Are you thinking about ending your life? Have you tried to end your life in the past? So school connectedness was really the only other piece of the puzzle. So again, just really emphasizing how key this is to keeping our kids safe, promoting their well-being. I know you wanted to talk about also, Kira, credible messengers.
Yes. And actually, before we do that, though, can you talk about how to know and what to do if there is a child who's not feeling connected, or if a teacher or a staff member is not, or a parent is saying, no, my kid is not one of those feeling connected and supported. How do you intervene on that?
Yeah, I want to also bring my colleagues into this discussion as well. But, I want to offer from the perspective of a child clinical psychologist, and just to say that sometimes the kids who need the most support and need the most validation are the kids that it's the most challenging to try to connect with and try to support. And, they may be the kids who have social skills deficits, or, they seem, agitated, maybe aggressive. I think it's so important to remember, especially in urban areas, especially with youth of color, that some of those behaviors that might look like aggression, that might look like defiance, are manifestations of trauma. And just remembering that sometimes the kids that seem like it's hard to love, they're the ones who need the most love, and really making those human connections with kids. A construct that we're really interested in is this idea of mattering, and how kids, how we as adults can make kids feel like they matter in communities. And it's certainly something that's protective against suicide. And certainly that's my area of expertise, but there's so many overlaps here, right, in terms of safety, because so many of our adverse events, kids who bully are at risk for suicide. Kids who are victims of bullying are at risk for suicide. The kids who are at the higher risk are doing both of them. They're being victimized and they're bullying, right? We see this overlap, of course, between, incidents of firearm violence in schools and kids who have risk for suicide. So I think it's, this overlapping array of risk factors. But Justin, Xingfang, do you have other things you wanted to talk about in terms of interventions around connectedness?
Yeah, and I just want to chime in and then say thank you, Cindy, for sharing this powerful message about school connectedness. This is really what we see across the board when we think about school safety strategies, when we think about how to engage students. Oftentimes we found when we look into how to engage students, this come up is that can we align their core value, what they need, what they want into the school safety strategy? And that speaks to the positive school climate. That speaks to the connectedness. That speaks to the trust and value and being valued at school and their environment. And those are the things that I believe our audience here are many educators. They know how to engage students in learning. It's the same thing in school safety strategies, is that as long as we can align these core values, then it's easier to see the program being successful. And so I think it's a segue, Kara, for me to talk about
Please.
what we learned from implementing and the effectiveness of anonymous reporting system, for example. So we are funded by National Institute of Justice, that by Justine Hansi and myself, to conduct a randomized controlled trial to see if this program called Say Something Anonymous Reporting System would be effective in preventing school violence and also in bringing up positive school climate. And here's what we found. This is really a very promising tool to enhance students' opportunity to report. And they're much more likely to report if they have the anonymous reporting system available for them. However, their effectiveness is really maximized by implementing as part of the comprehensive approach that Justin was talking about, that includes educational training and the focus of student engagement and bring up the positive school climate. So that training piece, the school-wide engagement with students, that aligning the core value of them wanting to be trusted and valued and feel they could trust the people they are seeing in school is such an important component we found for the program effectiveness. So the other thing we found for this programming is also when you offer trainings, you do want to offer to as many members in that school environment as possible. We found that if the program is offered, the training is offered to more than 90% of the student and staff, has much more positive outcomes than the ones that offer to only a third or only 50% of the school community. So that's one thing to really keep in mind. And I think here in Michigan, we also have this program that's similar for anonymous reporting system called OK to Say. And they are also putting many of these principles into practice. They offer training for students and staff. They facilitate community partnership, and they provide ongoing evaluation through the annual report to engage, ongoing improvement. So I think there are a lot of awesome things that we're seeing happening to build up this school connectedness and the comprehensive approach we're all talking about here. So this is my 2 cents.
Oh, that's fantastic. Thank you. And I think, Justin, did you want to talk more about the work that was done in North Carolina?
Sure. So it's sort of an extension from what Xingfang was talking about. So folks might have heard, if you're in the state of Michigan, about OK to Say, it's an anonymous reporting system. Xingfang was alluding to one in Florida. About 36 states at our last count have a statewide anonymous reporting system. And this is one of those things that is rolling out very broadly, very widely. From a true kind of empirical perspective, we don't know as much about these systems and how well they work. There's a lot of anecdotal evidence or evidence from the systems themselves where they can talk about the number of tips they've received or the type of tips that they've received. But we're trying to bring some of that scientific perspective to, all right, so when are these tips coming in? How many tips are coming in? What are some of the precursors, or what are some of the influences that might increase the likelihood of tips? When do students want to use this system versus talking to a trusted adult? And certainly, what sort of training or messaging from schools might facilitate students' either awareness of the systems or willingness to use the system, or ultimately down the road, we're hoping to inform how the systems operate. What happens post-tip? How are they triaged? How are they then working with different folks that would be trying to support the student, whether it's community services, whether it's law enforcement, whether it's the school, or oftentimes we find the referral goes to parents. And so what can we do to support parents who have received this information from their school that there was a tip about their child, whatever it might be. So trying to understand that piece of it, we think is really important, especially as these proliferate, because yes, having the system is wonderful. Xingfang mentioned that we can talk about the hypothetical or theoretical reasons for why they should work. And we also want to make sure that they're working as effectively as possible. So a CDC-funded study, I think this is one example of which, unfortunately, I think there are many cases where a program or a set of strategies are finding their ways into schools. And we want to make sure that they're complemented by as much data as we can. Again, talking from a researcher's perspective, but how do we really understand, and can we map these on to some of our understanding of human behavior, adolescent behavior, so that they can be operating as optimally as possible?
That's great. And actually, I'm just curious, do parents get educated and trained on the fact that the system is available? I don't know that that's done, routinely in districts, right? That parents should also know that they could report through the anonymous if their child comes to them with a concern, but they don't want to go forward to a school staff member with it.
So I think there are efforts. Again, I credit the Michigan State Police Office for School Safety. They do a lot of trainings around the state of Michigan to help folks understand OK to Say. You can see it on your child's iPad. You can see it on the back of their student ID cards in some places. But what makes me a little bit nervous, again, 36 states, give or take, as well as some other systems that might not be statewide, there's really not any sort of standardization. So even if we could say with a lot of confidence that yes, maybe parents are being exposed to this information in the state of Michigan, is that really happening nationwide? And I can tell you from our interaction with students and other folks in schools in the state of Michigan, even, there is often this gap between the availability of a system and knowing about it. And we saw the same thing in the state of Florida. The rollout takes some time, awareness takes some time. You have to build confidence in people in order to use it. You have to build self-efficacy for a student to say, yes, I have identified a concern, and now I'm going to take the steps to report this thing. That's a big thing for an adult to do, let alone a 16-year-old, a 14-year-old, or even an 8-year-old to make that step. And so even trying to work with students or reinforcing those conversations with parents about, hey, when you do see something, you say something, and here's how you can do it. And it's not just one, right? It's not going to only be the anonymous reporting system, but here are the different ways that you can express this concern. I might as well bring in the data conversation of those major school incidents. About 90% of them, 90% or even more, somebody knew that a student was a danger to themselves or others. Folks, in 3/4 of the incidents, more than 2 people knew or suspected that there could be a concern about a student's safety, either for themselves or for others. So this information is critical that we get it out there, that we understand how to identify, whether it's a mental health concern, whether it's a physical violence concern, whether it's happening now or could happen in the future. All of these pieces are something that we need to be thinking about, and from the research side, to really understand how they operate in practice.
And I wonder, and just this thought is occurring to me, this generation that's in school, in middle school and high school, especially now, this idea of mental health being something that they talk about more openly than it was maybe for our generation, right? And this idea of seeing anonymous reporting as something where you're expressing a concern that someone's not getting the help that they need, rather than a concern that they could hurt me, the person doing the reporting. Is there an aspect of that we could play upon?
I'll jump in and say, speaking from my, relationship with Michigan's OK to Say team, they have been wonderful partners for our suicide prevention community here in the state of Michigan. And for years, they have shared that the top 1 or 2 reason for the calls that come into OK to Say in Michigan are kids concerned about suicide risk in someone that they love at school. And I think it's a wonderful way to give kids a tool to try to support their friends, right? I mean, that's really hard as a kid to go to your friend's parent. Right. There's just a sense that you're maybe letting down your friend when you speak up. Of course, we know we never want kids keeping secrets about somebody else's well-being. So I think these anonymous reporting systems are a really wonderful opportunity for kids. I agree with you. I think it's part of that culture change that's happening, where stigma reduction is happening in terms of mental health. Kids are talking about it. My kids would say, yeah, everybody's in therapy, Mom. It's just so different than I think the way a lot of us grew up. And I think it's a great thing. Along those lines, Kara, I'd love to share a little bit about the peer-to-peer program, because I think that fits here too. We had talked earlier about, different strategies for student engagement, different ways to make kids feel like their voices and their perspectives matter in schools, and that they're valued in schools. And so I think this program called Peer-to-Peer that originated here at the University of Michigan in our Depression Center. And I was grateful to be, involved just a bit with it. But the idea was fantastic. Kids in schools who were really passionate about mental health or health behavior and health education, like our colleagues are in our School of Public Health, who were really asking for a forum to be able to, advance this cause in their schools, right? So, school counselors and educators, they often know who these kids are, right? So teams would get identified in local high schools. We brought them in to the University of Michigan and gave them training, like a day retreat about, what should you know about mental health, treatment works, these are some warning signs, how could you get connected, how could you help a friend? And then also some information about marketing strategies and communication strategies and that kind of stuff, safe and effective messaging. And kids would create their own marketing campaigns for their own communities. And I think that is such an evidence-based solution, right? Like we know that credible messengers matter, right? We see that with veterans talking to other veterans. That's helpful in rural communities. Rural folks talking to rural folks matter. We saw that in Black churches, right? So schools are a community, and so giving kids the ability to communicate a message to their peers that mental health is something that we can talk about in our school. The administration's cool with it. We can put our posters up and really, give that tangible message that that mental health treatment seeking is something that we value in our school community. I think it's really powerful, and
That's
I know
great.
there's some more resources for that. I imagine
Yes,
that
we'll
put it-
share the links to those. And the peer-to-peer program, I think, is still accepting schools that want to enroll and get their student communities engaged in this. It's still going on and growing. I think it's in multiple states now. So yeah, the peer-to-peer program, if folks want to find out about that or anything else, we'll be sharing those links on the social platforms where you're watching this, and also on the YouTube video where this will live permanently. And we hope you'll seek those out. Are there other Xingfang? Are there other things that you wanted to talk about around conflict resolution or prevention, community-based efforts that you've studied, or things where some community groups can engage with schools around reducing the threat of conflict or violence?
Sure. And I think this is maybe one thing we all notice is that we believe we know school already have a lot on their plate, parents, students all have a lot on their plate. And it's just not fair to think about, to yet one more thing to their mind and on their plate to do such a thing alone. And go back to what Cindy had mentioned, we're a whole community here ready to offer support. And what I have noticed is that there are a lot of community partners who are ready to take actions, to work with us, as long as there are tools, evidence-based practices and support. And that's where we can come in. That's where we can offer what we have learned from the research. We could translate the research finding in a digestible way for school and community partners who are ready to take action. So those are the things that come into my mind to share.
Great, thank you so much. And also, I think this idea, maybe we touched on this a bit, about when there's a community where there is maybe a higher rate of violence, and for teachers and staff to recognize how that affects kids. I think you talked about a little bit about, trauma being something that can affect a child's behavior at school and things like that. Does anyone want to mention that, sort of how what other violence prevention efforts are happening in the community setting can maybe interact with schools, whether that's law enforcement or other or the justice system, that kind of thing?
I'll just jump in and say, I've had a number of experiences working with community coalitions and community partnerships. And I think, unfortunately, everybody, we all have so much on our plates. You can go to work and just sort of put your head down and do what is on your calendar for that day. And if without having this kind of technical assistance support, like what the National Center for School Safety does, it can be really easy to fall into a silo, right? And I've had a number of experiences where, I've been working with an emergency department and I said, do you know anybody at your school? And they don't. And so creating these kinds of coalitions where schools feel like they're at the table with other folks who are taking care of their students in other capacities, the pediatricians, the emergency departments, the community mental health providers, your faith communities, as we were saying, our community violence intervention nonprofits that are such a powerful force for good in so many of our communities. And so really trying to support that referral network and that coalition for schools, I think it's really critical. And we know, again, from the suicide prevention community that this idea, when you see something, say something, right? In suicide prevention, it's like, if you're worried about a kid, you got to ask, you got to ask, how are you doing? But we know that schools and teachers, when they don't know where to send that kid, if they say, yes, I'm in trouble, they're really hesitant to ask because that's so hard. Like, then what are you going to do with that information? You care about that kid, you're worried about that kid. Sometimes it's easier not to ask if you don't know where to send them. So these kinds of coalitions where schools really feel connected in this web, people who are working with the same kids, I think it's a really powerful community intervention.
So the message here is both schools reach out and community organizations that could offer something to the schools, just reach out. Yes, great. And because we know that mental health concerns are strong, very much a thing with our younger people these days and growing, right? And we need to make sure they get help. You talked about the technical assistance. Maybe Justin and Xingfang, if you can talk a bit more about how that actually works. And not just the research you're doing, but if a school is interested in reaching out to the National Center for School Safety, how does that work? What happens next? And what have you had for examples of successes from it?
Well, so the first part's an easy one. It's as easy as clicking on a link and telling us what you need. So we try to serve sort of the gamut of concerns related to school safety. So whether you are thinking about coordination with community partners or first responders, whether you're thinking about youth empowerment to try to engage students. I love the way this conversation has moved away from, it's all the school's responsibility, but really we're a collective, it's everyone's going to be responsible for keeping these bedrock institutions safe. So you can make an appointment with our TA specialist. We'll try to map on some of the folks that we have on our team to the particular concerns. So we do have folks that have previous experience in education, previous experiences in law enforcement, previous experience, all these different facets of school safety. So we're trying to align those concerns with what folks are asking us about. Again, usually it starts with a Zoom conversation, so there's not a commitment. Again, these are freely available to anybody who wants to use them. We try to support schools, not just as a one-time, one-off conversation, but through sort of the planning phase and also the sustainability phase as well. So it's not just let's try to resolve this problem now, but how are we also kind of thinking through how's this going to stay, how are we going to keep this going? We understand that turnover is a major concern. We understand that time constraints and fiscal constraints all weigh into how well schools can implement some of these programming strategies. And we're here to be a partner for schools to think through those things so that it becomes ingrained in the culture, that it becomes something that's going to live beyond, for example, the period of a grant cycle, or if someone does transition to a new role, whichever it might be, the safety aspect and elements stay the same. And again, so we've been doing this work since 2019. We have found that schools approach us with a variety of different challenges. So we have worked with schools to mediate conversations between the schools and some of the invested parties within their community, whether it's law enforcement, whether it's the school board or school officials. We've worked with communities that are implementing culturally relevant programming, so perhaps doesn't map on to some of the existing or extant programs that are out there. And so how can we pull out or draw out some of those elements of the way that they're engaging from their culture and extrapolate those lessons learned for others who might be struggling. There's not a program out there that's going to support our students the way we want, but here's another program or here's another school that's doing something similar. So we try to create a community of practice opportunities so that schools can learn from each other, especially if there are things that are working, in particular with emerging things, for example, swatting, some incidents where people are calling in. These are things that there aren't a lot of evidence-based programs to address, but we do know schools are dealing with them. Are there lessons learned from the field that we can then in turn share with others in a systematic way? So I think that's the gist of it. Give us the call, and we will work with you to try to help you suit your needs.
And I'll just give those two websites. So the National Center for School Safety is www.n as in Nancy, C2, the number 2, S as in Sam.org. So nc2s.org. That's the National Center. And then if you're a Michigan school, you can go to the firearminjury.umich.edu website and get to the Michigan School Safety Initiative page on that institute site and learn more about Michigan. Just to clarify, can private and charter schools take advantage of this service as well?
So we're going to try to work with anybody who wants to work with their students. There are, to the extent that the concerns, we will try to help you as far as we can. And we can also direct you to resources that are out there in the field if what we are hoping to work with you to do isn't going to be sufficient. Or
excellent. I also want to mention to anyone watching, if you have a question, now's the time to type it into the comments or send us a direct message on Facebook to Michigan Medicine via direct messages, and we'll try and get to those in our last minutes of this webcast. I did want to mention one other thing that I think schools are grappling with now, with Michigan having these new laws around safe storage requirements for firearms. So firearms owners now being required to have them locked and not accessible by young people who might be in their home, whether that's their children, their grandchildren, or a visitor. And what's the role of schools in educating around that? And maybe, Cindy, can you just talk about the statistics around firearms and suicide specifically?
Yeah, sure. So, we know that a majority of the suicides that are completed in the United States are completed with a firearm. And so, if we're serious about making a difference in suicide prevention in the United States, we have to have some policies that are around firearms. And I'm really feel very fortunate to be raising my kids in Michigan right now, where we do have some of these new laws on the books that are, part of this toolkit for supporting families. So, I think the other thing that I think a lot about, both as a mom, a child clinical psychologist, is, we have a lot of kids in the United States right now who are hurting, right? We had a mental health concerns about kids before COVID, but certainly after COVID, we have a lot of our national child serving groups, Children's Hospital Association, American Academy of Pediatrics, American Academy of Child and Adolescent Psychiatry. They've declared a children's mental health crisis, which all of you working in schools are very aware because you're living this every day. But I think what kind of keeps me up at night is the number of kids that we lose to suicide in the United States every year. And no one who loved that kid knew that they were in distress and mental health distress, because kids are good at hiding those things from people who love them. And about 3/4 of the kids that we lose on an initial suicide attempt, which is often when we didn't know they were in trouble, we lose them because they find a firearm and they use that with their initial suicide attempt. And we don't get a second chance with those kids. And so really being sure as parents and people in communities that the firearms that we might have in our home are stored under lock and key. And so what do we mean by safe storage? It is the ideal scenario is you take your ammunition out of your firearm, your ammunition is in one place and locked, your firearm is unloaded and locked in another place. And that's the ideal scenario. I know there's a lot of reasons that people keep different scenarios in their homes. And certainly, you have to find a solution that works best for your family. But that I think schools have a really important role to play in terms of helping to get that message out to families. And, I often think of it like how our pediatricians all told us to have our kids wear bike helmets when they started riding their bikes. And they asked us if we baby proofed when our kids started walking. And, this conversation about making your home as safe as possible from a firearm perspective is just part of keeping kids safe. And schools really are pillars in the community of working to support kids' well-being. And so I think this idea of really encouraging families to store safely is a part of that. I've shared with these guys that my own school district includes that in our back to school paperwork. And they ask us to, read an attestation our school board approved, just some messaging about it that goes in our back to school paperwork. And I just got to click, I've read this and I understand. And I think it's just a way to remind folks about a different part of safety.
That's great.
And I just want to, sorry, Kara, to add to Cindy's point, I think about the secure storage promotion and how we can engage schools and the surrounding community. This is one example where we see community partners are ready to help too. They may have existing programs, they may have trained trusted messengers, trained parent messengers or youth messengers that could work with school and offer resources. So again, we're sharing things. We're sharing. We're trying to figure out things together, and this is one way we could bring in community partners.
That's great. And actually, this idea of, you mentioned the pandemic, and obviously there was some extra funding that was flowing to schools because of pandemic funding. Is some of that, still available to use for things like what we've been talking about, better mental health support, more awareness of safe storage, more efforts to do trusted messenger and community engagement? Is there, or is there a funding cliff happening for this kind of work? I've stumped them. But I think every school, yeah, go ahead.
I just think it's variable. I think it depends on the community. I think it depends on the state. Yeah, but this idea of, schools being a part of a larger network, like for example, I know there are groups, through the Michigan Department of Health and Human Services that have funding for cable locks and trigger locks and that type of thing. And I'd love to see schools becoming a place where families could access things like that. Just really simple things that could keep their homes safer. A lot of folks who tend to be distributing those kinds of resources are our law enforcement partners. And I think that's a safe place and a convenient place for some families to get those kinds of resources. But in some communities, walking into the police station maybe doesn't feel as safe or as comfortable. And so our real trusted institutions like schools or churches could be a nice place to distribute those kinds of simple, very low cost interventions that can keep our homes a little safer.
Excellent. So I have one last question for all of you, and you can jump in however you'd like. And just you're getting your personal perspective on this. So, this idea that there's maybe a sense of hopelessness that people might feel around school violence and firearm violence in general. And can you share your thoughts on how do we change that narrative? What gives you hope? Whoever would like to jump in first.
Yeah, I'll try me first. And I think I oftentimes try to tell myself each of the steps we're taking, even though it seems it's not making a difference, we can imagine it's like planting a seed. And each step is the seed, and each of us can plant as many seeds as we want. And it takes time, but eventually we'll see forest if we all work on it together. And that's how I see, when we see more research is beginning done than ever, and especially around firearm-related research and school safety research, and more partners are coming in to care about it. And so it's happening. We just have to give it some time.
I will say that I want to acknowledge the hopelessness, that folks feel. And I think one thing that's really hard for schools is this idea that you know your kids deeply. You've watched them grow up in your buildings. You know their families. You know what they're struggling with. And I think one thing that that is really hard is when a kid needs mental health support and it's difficult to access that support, right? Because we do have a lot of waiting lists out there. It is really hard. It's you might call and be told you can't be seen for 6 to 12 weeks, and that's really hard. But I guess I would just really like to empower my colleagues who are working in schools to just remember how important you are in the lives of the kids that you're supporting, right? And the school connectedness piece, the idea that we really do know what it takes to raise healthy kids. We do. And, as a clinician, if a kid came into care with me, some of the first things I would do with them in therapy are things that you're doing too. And it's telling them, get 8 hours of sleep a night, eat some good nutrition. What brings you joy? Let's do those things, right? Who can you talk to that's an adult who has, can support you, who can give you some social support and some emotional support and help you problem solve, right? So there are a lot of those things that we do for kids in therapy that teachers and administrators in schools, you guys can do those things too, and you can get it started while they're on a waiting list for mental health support, and then we can sort of pick up the baton. But just remember that you know a lot about how to help and care for kids, and what you're doing every day when you show up and make kids feel like they're important. That's suicide prevention. That's creating a safe school, and it really matters.
Thank you, Justin. You get the last word.
I guess as I think about it, hopefully the conversations that we're having, they're not reactive. They're all about, we want to make sure that we're ready. We want to make sure that we have these things in place. We want to make sure that we're doing everything that we can to support our students. And again, it's not just the physical security side. It's recognizing that all these different facets are part of the school safety conversation. And when we talk to schools, that more often than not, I'm thinking, wow, you folks know a lot. It's not as though I'm saying this is all new stuff the first time. It's like, oh no, we're rocking and rolling. We want to do even better, or we want to make sure that we're following what the science is telling us, whichever it might be. So these conversations we're having, over and over and over again, give me a lot of confidence that this has become built into the way that schools are thinking about their school years, how they're thinking about working with their student populations, their staff populations. And that's very hopeful for me that we've moved into a proactive frame of mind around these issues.
Fantastic. Thank you, all of you, for being with us today, our three experts. And thank you for everyone who's watching, whether it's live or as a recording, and who cares about these issues. We really want to make sure you know that the University of Michigan Institute for Firearm Injury Prevention is here to support schools and to connect communities and interested parties with schools that need more support for their students, and parents to know that this is available, and you can tell your school about this institute's work as well. And so for anyone who wants to learn more about the Institute for Firearm Injury Prevention and the work on school safety it's doing, just visit firearminjury.umich.edu. You can sign up for an email list. You can follow them on LinkedIn, and you can share this video. We'll have this recording available afterward. We really do hope folks will share it and help get the message out that there is some help available for schools, and that these key messages that our three amazing experts share today, this is hopeful information, useful information, actionable information. So thank you all for joining us.